Ulcerative colitis. It is an autoimmune disease. Look at this picture, shows that colons, X-ray findings, CT findings, then MRI, detail going on. Introduction. Ulcerative colitis is a chronic inflammatory bowel disease (IBD) that primarily affects the colon and rectum. It causes inflammation and ulcers in the innermost lining of the large intestine. Leading to symptoms such as abnormal pain, diarrhea, and rectal bleeding. UC can significantly impact a person's quality of life and requires long-term management. A definition. Ulcerative colitis is defined as a chronic, relapsing, remitting inflammatory condition of the colon, characterized by continuous mucosal inflammation extending from the rectum proximally to a varying extent. Unlike Crohn's disease, another form of IBD, UC is confined to the colon and does not affect the entire gastrointestinal tract. Types. UC is categorized based on extent of colonal involvement. 1. Ulcerative proctitis. Inflammation is confined to the rectum. 2. Proctosigmoiditis involves the rectum and sigmoid colon. 3. Left side colitis extend from the rectum up through the sigmoid and descending colon. 4. Pancreatitis involves the entire colon. 5. Acute severe ulcerative colitis, a severe form of pancreatitis, requires immediate medical attention. Causes. The exact cause of UC is unknown, but it is believed to result from an inappropriate immunoresponse in genetically susceptible individuals. Factors contributing to UC include: 1. Genetics. Family history of UC increases risk to immune system, abnormal immunoresponse to gut flora. 3. Environmental factors. Diet, stress, and lifestyle may influence the onset. 4. Microbiome dysbiosis or imbalance in the gut microbiota. Risk factors. 1. Age. UC commonly presents between age 15 to 30. Second, ethnicity. More prevalent in Caucasians and people of Ashkenazi Jewish descent. 3. Family history. Higher risk if a close relative has UC. 4. Geographic locations. Higher incidence in developed countries, urban areas, and northern climates. Complications. Severe bleeding can lead to anemia. Second, perforated colon, a life-threatening condition. 3. Severe dehydration due to chronic diarrhea. 4. Osteoporosis, often a result of corticosteroids use. 5. Inflammation beyond the colon, affecting skin, joints, eyes. 6. Increased risk of colon cancer, especially with long-standing disease. Pathophysiology. UC involves a inappropriate immunoresponse that leads to inflammation and ulceration of the colon's mucosal layer. The exact mechanism are complex and involves one, epithelial barrier dysfunction, increased permeability allows antigens to penetrate. 2. Immunoresponse, activation of T cells and release of pro-inflammatory cytokines. 3. Genetic susceptibility, genes like IL-23R and HLA variants play roles. Signs and symptoms. 1. Diarrhea, often with blood or pus. 2. Abnormal pain and cramping, especially in the lower left abdomen. 3. Rectal bleeding, blood in stool. 4. Urgency to defecate, often accompanied by tenesmus. 5. Weight loss due to decreased appetite and nutrient absorption. 6. Fatigue from chronic inflammation and anemia. 7. Fever during severe flare-ups. Diagnosis. 1. Clinical evaluation, detailed medical history and physical examination. 2. Laboratory test, blood test for anemia, inflammatory marks, CRP, ESR. 3. Stool test to rule out infections. 4. Endoscopy. Colonoscopy with biopsy is the gold standard for diagnosis. 5. Imaging. abdominal X-ray or CT scans to assess complications, nursing diagnosis, 1 acute pain related to intestinal inflammation and cramping, 2 diarrhea related to bowel inflammation, 3 imbalanced nutrition, less than body requirements due to malabsorption, 4 risk for fluid volume deficit due to diarrhea, 5 fatigue related to chronic disease and anemia, 6 anxiety related to chronic illness and its implications. Management. Acute management, 1 hospitalization for severe cases, 2 IV fluids and electrolytes to manage dehydration, 3 blood transfusion for severe anemia, long-term management, 1 medication, aminosalicylates, corticosteroids, immunomodulators, biologics, JAK inhibitors. Second surgery, colectomy in severe refractory cases. Treatment, 1 medications as outlined in management, 2 diet and nutrition, balanced diet, avoiding trigger foods, 3 probiotics to help restore gut flora, 4 regular monitoring, colonoscopies to screen for cancer, 5 lifestyle modifications, stress management, regular exercise. Psychosocial medicine, 1 support groups for sharing experiences and coping strategies, 2 mental health support, counseling or therapy for depression and anxiety, 3 education, patient and family education about the disease and management. Prevention, genetic counseling for those with family history. Second, healthy lifestyle, balanced diet, regular exercise and stress reduction. 3, regular medical checkups, early detection and management of symptoms. Conclusion, ulcerative colitis is a chronic condition requiring lifelong management. While there is no cure, treatment can help manage symptoms, induce and maintain remission and improve quality of life. With appropriate medical care, lifestyle adjustments and support, individuals with UC can lead fulfilling lives. Early diagnosis and proactive management are key to reducing complications and improving outcomes. Thank you. Have a wonderful day.